Hello everyone, I am Dr. Vikas Sharma. I am a skin specialist and hair transplant surgeon. Today in this video, let us talk about blackheads on nose and the methods of blackhead removal. This is a very common problem and a lot of patients want to know the solution. So first, before discussing the treatment of this problem, let us try to understand what causes blackheads on nose. Blackheads on nose can be caused by mainly two types of skin problems. Number one is pimples or acne, and number two is trichostasis spinulosa. Let's first talk about acne or pimples. Those who have pimples tend to have blackheads, especially around their nose and on their forehead or on the cheeks as well. This problem can happen in any age group. It primarily affects the teenagers, but it can happen in older age groups as well. When it is seen in older age groups, it primarily happens because of sun damage. Blackheads and acne happens because of increased oil secretions from your skin glands and also because of dead skin cells. These oily secretions and these dead skin cells, they combine to form a black plug which obstructs your skin pores, and thus you see a blackhead on your nose or elsewhere on your face. If you notice carefully, this blackhead in acne will be a little bit elevated from the surrounding skin. So this is what can be used to differentiate it from the blackhead seen in trichostasis spinulosa. Now for the treatment of blackheads in acne, the simplest thing that you can do is comedone extraction with the help of an instrument which is known as comedone extractor. This instrument has a long handle and a very small ring attached to it. Now when this ring is placed around the blackhead and the surrounding skin is pressed with this ring, the blackhead like plug, it comes out. Now this can treat blackheads very quickly, but for maintenance of these results, your doctor may prescribe you some medicines. For example, benzoyl peroxide gel, adapalene gel, tretinoin gel, or azelaic acid. So all these medicines may have to be continued to maintain the results. Sometimes your doctors may also use chemical peels to treat acne. Now all these medicines that I have mentioned and the chemical peels that I have mentioned, they should be done under a doctor's supervision as they have certain side effects. Now the second common reason for blackhead-like appearance on your nose is trichostasis spinulosa. In this condition, small black baby hair are retained in your skin pores. So normally what happens is whenever a new hair is growing, the old hair is shed off. But in trichostasis spinulosa, small black baby hair are retained successively over hair cycles. So even when the older hair has not shed off, a new hair starts growing. This clump of hair gives an appearance of a blackhead on the nose. Now if you notice carefully, these blackhead-like spots are not elevated as compared to the surrounding skin. Also, if you look at it under a magnifying lens or if you take a picture and zoom it in, you may see small baby hair coming out of your skin pores. Now for the treatment of trichostasis spinulosa, we have to destroy these hair roots. The best treatment is laser. There are two types of laser which are used for the treatment of trichostasis spinulosa. One is diode laser and the second is alexandrite laser. Both these lasers, with the help of heat, destroy the hair bulb which produces these hair. Since these lasers, they destroy the roots of the hair, so the results of these procedures tend to be long lasting. Now usually 1 to 2 sessions of these treatments are required and they are done at an interval of 1 to 2 months. As far as side effects are concerned, by and large, these procedures are very safe in most of the patients. The most common side effect that is seen with these lasers is redness, which lasts for a couple of hours to maybe a couple of days. Rest of the side effects are very uncommon. Now, there are other methods also which can be used to treat trichostasis spinulosa, but they are not usually very effective. For example, moisturizing creams have been tried. Then people use exfoliating creams, retinoid or vitamin A-like creams. Then hair removal strips or tapes which stick to the hair that are there on your nose and then pull them off when you remove the tape. So all these methods have been used for treating trichostasis spinulosa, but they do not usually give permanent results as the root is still intact. Now in this video, I have tried to tell you everything about blackheads on nose. If there is anything else that I have not been able to answer, please let me know in the comment section below. I will try to reply to all your questions.